So again, welcome everyone to our InForum. My name is Alvin Glim, Vice President Strategic Partnerships here at United Way. And I have the honor to welcome to the stage to bring greetings Ms. Juanita Shepard, our Vice President of Foundation Relations. Thank you.
Good morning, everyone. I am Juanita Shepard, and I serve as the Vice President for Foundation Partnerships at United Way of Greater Atlanta. We're thankful for you joining us, along with many of our community partners and friends. I also want to take the time to thank our sponsors, public supermarkets, charities, and Kaiser Permanente. Without their support, this would not be possible. At this time, I would also like to acknowledge any of our board members and advisory board members who may be here and present on our behalf. They serve as our representatives throughout the regions in Greater Atlanta. If you are here today as a board member or advisory board member, please stand so we can acknowledge you. Grateful, everyone has a role to play in building strong communities, whether you live or work in any one of them. No one institution can do this alone. We have to work in collaboration. United Way's Child Wellbeing Movement provides the opportunity for collaboration between the school systems, nonprofit, businesses, residents, county and state governments. This is why we've come together today, to collaborate. We are here to share insights from our Child Wellbeing Index, which provides a comprehensive evaluation of child well-being in Greater Atlanta, so that each of you can use your unique experiences to provide input on the problems that we're facing. By the end of this InForum, it's our goal that you will not only have a greater understanding of the obstacles hindering young people in our city, but also a newfound enthusiasm for helping to reduce even those obstacles. To have an impact on the well-being of children, it is essential for children and their families to have access to health care, education, community, and resources. This work should be driven by the voices in our community, those who live this work out day in and day life through their lived experiences. Real change requires time, commitment, and resources that don't fit into a grant cycle. It's imperative that we stay focused and engaged in the work we're doing that we're so passionate about. We must continue to invest in infrastructure, organization, neighborhood-level efforts, and other commitments to community that uplift our mission of child well-being. Everyone feels the effects of maternal health disparities. These disparities, such as inadequate prenatal care or maternal health conditions, can lead to adverse birth outcomes and childhood health issues. These early childhood health issues can then impact the overall well-being of our children and their families that perpetuate cycles of poverty, poor health across generations. As we move forward in addressing equity, we need to be intentional about reaching everyone. Let this be a time that we open our hearts and our ears and truly listen to the issues facing our community today. At this time, please welcome to the stage our Vice President, again, of Strategic Partnerships of United Way, Mr. Alvin Glyph.
Thank you, Juanita, Vice President of Foundation Partnerships. Thank you. So I'm here today to talk a little bit about our groundbreaking data. The data team has done some amazing things with our Child Wellbeing Index. But before I get there, I definitely want to do some house cleaning things. So one, before I get going, I want to point out that you have a table tent with a QR code that will take you to our electronic version of today's program and our workbook. And so in the spirit of collaboration, that workbook is meant to be utilized as a way to guide you through the data and insights that we prepared today. I also want to make sure you see the commitment card, that's commitment to community, that's in front of you. You're going to need that later as we go through the program. And so thank you in advance for your participation. And so now let me talk a little bit about the insights. But Juanita touched on it, but I definitely want to make sure people understand that today's InForum is all about you being different by the time you leave. It's not about just hearing from our amazing panel. It's not just from the coffee, the food, this amazing space. This is ultimately about what you hear after you have these table talks. You write on that commitment card what you're going to do different to advance the cause to improve what's going on in terms of some of our maternal health disparities in our region. So this is our third round of InForums, but always like to ground us in why we are here today, what United Way is all about in terms of child well-being. Child well-being for us is not just about the children, it's ultimately about this belief that for children to thrive, families are thriving. When children and families are thriving, the community and business around them are thriving. So ultimately, child well-being is a holistic approach to improving our region. But once we started and put our stake in the ground and said United Way is about child well-being, we really had to get a sense of how well we're doing serving children and families, thus the creation of the Child Wellbeing Index. So if you go on our website, unitedwayatlanta.org, you'll see all of this information about what we learned from 2023's release of our Child Wellbeing Index. The index is comprised of 16 different measures. The one that we're going to focus on a little bit today that has direct connection to our content of the agenda is the percent of low weight births, right? But as you see, as you look at all of our measures, it's a very holistic approach to measuring how well we're doing. And when you add these scores together, it allows us to get a sense of when you look at this neighborhood compared to this neighborhood, where are the disparities? Where should we make sure resources are getting so that the families, the children that need them most are getting them? Here is our map, and once we get our scores, essentially we create a heat map based on these 5 child well-being conditions right here. And the scores are created at the region level, at the county level, and then ultimately at the census tract level. And once we create those scores, we put them in a child well-being condition category, and that's where the heat map is then created. So what it allows you to see visually is based on the dark blue and the darker blue, where the needs are greatest in our region compared to other communities. And that's why we're here today to talk about some of those disparities. Because maternal health is one of those issues that ultimately, while it's not reflected directly on our index, it has a huge impact on the quality of child well-being in our community. Wanted to just offer up a sense of what the low child birth weight data looks like. So on this side is our child well-being percentages for each of our 13 counties in our footprint. And so as you can see, overall, we have an average of 10% of our births are low birth weights, but there are 7 counties that are actually above the regional average. And then the map actually gives you a sense of visually what region has some of the greater disparities, where is the need greatest. And so as you see, you're looking at DeKalb, you look at Fulton and Clayton, that's where you see a lot of the dark blue colors, right? So that gives you a sense of, for this particular measure, where are the highest percentage of low child birth weights? So, of course, wanted to give you a sense of where we are nationally, because at the end of the day, and you'll hear it from our panel, our state is not doing well at all, right? So the disparities, you'll see them in terms of, you got 3 times as many Black women are more likely to die from pregnancy-related complications, disparity, right? And so overall, Black women in Georgia and Atlanta are disproportionately represented in some of these outcomes. And so I'm looking forward to hearing this conversation today, because ultimately, that's what we're here to do something about. More data from the March of Dimes. You have the infant mortality rate declined by 10% in the last decade, but the rate among babies born in Black birthing people is still 1.9 times the national rate, right? So again, here are some of the numbers that we're here to discuss. Here are some of the issues that we're trying to work around. So as you're talking at the tables and doing some of the table talk, remember some of this data along with some of the insight that's provided from our panel as you think about what is it that we can do as individuals in the seats that you sit to make a difference. And the last thing before I pass it to Regional Director Andrea Tyson is our state gets a failing grade of an F. Not for fantastic. So we have a representative from the March of Dimes, so looking forward to hear more of that. But at the end of the day, please keep this in mind because Georgia is too great of a state to allow this to continue, right? So I would like to please welcome to the stage Regional Director Andrea Tyson. In March of 22, Andrea Tyson was appointed to serve as the Regional Director of U.S. Department of Health and Human Services for Region 4. As a presidential appointee, Regional Director Tyson provides executive leadership in Region 4 as the primary representative to the Secretary of Health and Human Services. The Office of the Regional Director, which is based in Atlanta, is also tasked with intergovernmental and external affairs, which brings together federal, state, local, and tribal government organizations and private sector businesses. In this role, Regional Director Tyson is responsible for 8 southeastern states, including Alabama, Florida, Georgia, Kentucky, Mississippi, North Carolina, South Carolina, and Tennessee, as well as the region's 6 federally recognized tribes. Please, without further ado, welcome to the stage, Regional Director Andrea Tyson.
Good morning, everyone. And thank you, Alvin, for that introduction. And I think it's quite fitting that on the morning that I come to talk about mamas and babies, that this daddy will leave his notes on the counter in a haste to get my baby out of the house to nursery so I can be here in time, but that's fine. So, again, my name is Andrea Tyson, and I have the honor of serving as the Regional Director for the U.S. Department of Health and Human Services, and that is quite an honor. And normally in my introduction, I talk about how I'm happy to be here today. But I must admit that would be totally disingenuous considering the topic that we have to discuss today. For us to have to talk about maternal deaths, dying mothers in a country as rich, as well-developed, and as wealthy as the United States is, that is appalling. It's quite embarrassing. And we all know the stats, and Alvin went through them. The United States ranked as one of the highest, you all can hear me okay? Ranks the highest among developed nations when it comes to maternal mortality and morbidity. And black women are 3 times as likely to die in birth than their white counterparts. But what's even more disturbing, that the CDC has found that 80% of maternal deaths are avoidable. So, it irks me to have to come talk about dying mothers in a country like the United States that can do better. But I'm thankful to you all for being here, for the United Way, for hosting this conversation, so that we can get to the bottom of this. Because we all know, and the administration, we do not shy away from explaining why these disparities exist. We know a lot of times it's just blatant racism, where black mothers are not being heard, where they're informing and telling people that something is wrong with them, but their requests and concerns are being ignored. And we also know that a lot of it is due to social factors that are results of institutional racism. The lack of health care, the lack of clean water and air, the lack of healthy foods, the lack of transportation, and the list goes on, and we tend to call it the social determinants of health. But this administration has prioritized maternal health as probably the top issue that we are working on. And as many of you know, and I know I'm preaching to the choir, in 2022, Vice President Harris issued the blueprint on addressing maternal health. And where we identified 5 areas where we wanted to make some significant progress, and we are on our way to do that. Where we wanted to increase access to health care for mothers, and that also includes mental health. We wanted to hold hospitals and physicians and primary care professionals accountable. We wanted to improve data collection. We also wanted to increase diversity within our workforce because we understand culturally competent care is the key to making sure that Black mothers get the work and the services that they need. And finally, we wanted to also make sure that we were tackling those social determinants of health. So what we've been able to do under our administration, within the first few years, we had over 40 states expand Medicaid for postpartum mothers from 2 months to an entire year. Thank God Georgia's one of them. We just need them to expand Medicaid, period. And we've also issued or established 2 hotlines for mental health. One, I hope everybody knows, is 988, so that if you're in mental health crisis, you have a quick and easy number to call. But we also established one for mothers. 1-833-TLC-MAMA. That's like 1-888-852-6262 for any of y'all that's writing. But we wanted to provide access to care because we understand that the year after, and even 2 years after, or however many years after, when postpartum mothers need someone to talk to, they need to be able to call somebody who cares. 24 hours confidential. We've also established a birthing friendly designation through CMS so that you can go online and figure out what hospitals and what health systems are actually doing the best when it comes to child delivery, childbirth, and also know which hospitals to stay away from. In my office, we're working on increasing diversity in the workforce pipeline initiatives. We have 3 or 4 that just running out of my office alone. But then we also are investing in doulas and making sure that we are having people and support in the birthing room and, be there with you in prenatal and post-term to help support mothers so that they have someone that they can lean on and actually serve as a voice for them. And finally, through the Health Resources Services Administration, we've been able to invest $42 million in Georgia alone to help support Healthy Start initiatives and other programs that help to address the social determinants of needs here in the state. So before I take a seat, I want to make sure that you all please connect with myself and some of my colleagues, one in the back, Natalia's in the back, and we have Jeff in the front. We're here to help. We want to know how we can be better partners with you, how we can support you in the work that you do. Luckily for you, our office is right downtown, so as a regional director, I get the luxury of just going down the street to work every day and being able to talk to you on a daily basis. So please feel free to reach out to us, and we can help support you in any of the initiatives that you have. And I look forward to having a great conversation and working with you soon. All right? Thank you.
So, a few things before we bring up the panel. One, shout out to Sketch Effect over here in the corner. A regular part of our InForums in the region, the Atlanta region. And so what's happening here, this artist has started with a blank slate and is capturing the ideas, the concepts, the names to make this a record of what is happening here today. It will be part of what we send you out in terms of his event, but definitely want to make sure we shout out Sketch Effect, who's in the building. Also want to just thank the federal government for being here, right? It was from the initial conversation with his office, they have leaned in and offered support, offered partnership, and so I appreciate you being here and just definitely value all that you bring to our community. Thank you. Want to make sure we shout out my staff, not my staff. my colleagues, United Way people, can you just raise your hand? Because while my role is standing up here on stage, please believe there is so much more work that goes into getting this event to go right. So just definitely want to make sure that these people that came out early, appreciate your support and what we do here. So thank you. And then lastly, I just want to shout out, I'm about to bring up our moderator, but Kaiser Permanente has been an amazing partner. And so as I think about, thank you. As I lead into introducing our panelists, just want to make sure we shout out Kaiser. Publix is also a big sponsor, but Kaiser has not only offered up sponsorship, but they've offered up space, staff, and have just really bought into this idea of this child well-being index is a resource that should be brought out into the community. So just want to thank Kaiser for all that they do to support United Way and this child well-being movement. Now, I am so excited to introduce our moderator, Dr. Sylvia Morris, who, for anyone who came to the one in November, this might sound like a redo because she was our moderator that time. So just for, if you show up twice on InForum, you did your thing. So thank you. Dr. Morris is currently a hospitalist and area physician market leader at Kaiser Permanente. She serves on the Johns Hopkins University Berman Institute of Bioethics Advisory Board, Georgetown University Medical Alumni Board, and Western Governors University College of Health Professions Nursing Advisory Council. Please give Dr. Sylvia Morris a warm welcome.
That's an introduction, and apparently I need to really do a good job this time in order to be invited back. So we're going to try and keep the bar really high. So good morning. I just want to make certain that I first thank all of you for coming, and thank you to Kaiser Permanente as well as Publix Charities. Today we have a wonderful panel. And my job is simply to get out of the way and allow the experts to talk. Our goal is that you leave here with more information about maternal health in the state of Georgia, and also to be activated to improve have more healthy communities and healthy mothers. And with that, I will go ahead and introduce our esteemed panel. Our first panelist is Jemea Dorsey. She currently serves as the Chief Executive Officer for the Center for Black Women's Wellness, a community-based nonprofit organization committed to improving health and well-being of underserved Black women and families in Atlanta. Our second panelist is Tamara Mason. She is the Director of Maternal and Child Health Collective Impact at the March of Dimes, where she leads the efforts in Atlanta to reduce inequities in preterm births and maternal mortality. Our third panelist is Rashan Knight, Director of Strategy and Execution for Primary Care and Women's Services at Kaiser Permanente. She oversees a broad spectrum of services across 25 regional offices, including adult and family medicine, pediatrics, OB, maternal fetal medicine, and maternal child health. And our final panelist is Wendy Miller, Program Manager for the Children's Medical Services Program at the Fulton County Board of Health, where she serves children and young adults from age birth to age 21 with chronic medical conditions. Let's please welcome our panel. Wonderful. So good morning, ladies. Maternal health is in the news. So whether we're talking about in vitro fertilization, if we're talking about the maternal mortality rates and reproductive rights, certainly it is top of mind. But let's kind of level set for everyone in the audience and talk about maternal health. Maternal health, we'll just give you a little definition here. We'll do that throughout. Maternal health is the health of women during pregnancy and the postpartum period. The goal of maternal health is healthy mothers and healthy babies. So for our panelists, tell me, what contributes to healthy mothers and healthy babies?
Well, good morning, everyone. So I say and again, I'm Jemea Dorsey with the Center for Black Women's Wellness. And I think what's critically important is looking at a life course perspective and the health of a woman before, during, and after a pregnancy if she ever chooses to become pregnant. And I've always thought that maternal health has to be looked at more broadly. It really is women's health. And I think that while we talk about, and the child well-being index is so important, right? But we can't talk about healthy children until we're talking about healthy mamas and, where an entire family and community that's healthy. So I think that's important. And certainly insurance access, I want to, you've lifted up so many wonderful things, just in terms of access to care, having a holistic support system, and that includes mid-level providers, doulas, other childbirth workers. So I think that it's really a broader perspective of what does it look like to be healthy before you ever decide to become pregnant.
Absolutely. Thank you very much. Tamara, do you want to add on to that?
Yeah, I do. I'm actually going to piggyback. So Tamara Mason, as mentioned, March of Dimes, and I totally agree with you, Jemea. I think we have to start talking about healthy communities, and communities, women, right, being healthy before they even become pregnant. So one of my favorite quotes, if you get to know me, I have like 3 standard quotes, 3 standard jokes I say at every talking event, right? So the first one is that pregnant women do not live in a vacuum, right? So if a pregnant woman is food insecure, if a pregnant woman is housing insecure, honestly, here in Atlanta, if a pregnant woman is poor, right? Atlanta, I'm sure many of you know, Atlanta is the #1 income inequality city in the country. So if you're born in poverty here in Atlanta, you only have a 4% chance of escaping poverty, right? That all impacts maternal and child health outcomes. That's going to impact the maternal health, the journey that she's having as she's pregnant, and that also impacts her family. So totally agree with Jemea that we have to just, in general, start looking at a more holistic, well-rounded approach, because we don't exist in a vacuum, right? We're not just a pregnant person. I'm not just a March of Dimes worker. So.
Rashan?
I have my own.
Passing the microphone, right? Community.
Rashan Knight with Kaiser Permanente. I really want to focus on the health aspect of maternal health. I appreciate everything that Jemea and Tamara said, which is wholeheartedly applicable. But in this case, as a nurse and representing Kaiser Permanente, where we focus on proactive care, health for the mother during her maternal course starts far beyond pregnancy exists, including taking care of the social determinants of health as well. But for health, one, we've got to focus on our weight, right? Obese women are leading causes of low birth weight. They tend to have high blood pressure. When we think about preeclampsia, they tend to be diabetic. And so if we can focus on weight, blood pressure, diabetes control, mental health, we're talking about poor socioeconomic communities as well. How do we make sure that vaccines are up to date, STD testing is done, and treated ahead of pregnancy, because all of these things have an unfavorable impact on not only mom, but baby as well, particularly low birth weight babies. So again, weight, blood pressure, diabetes control, vaccines, mental health, and STD testing and treatment ahead, which all of that really begins with prenatal care as well, but far ahead of the antenatal or pregnancy course.
Thank you, Rashan. And Wendy.
Good morning. I'm Wendy Miller. I definitely agree with everything the other panelists have mentioned and lifted up, but I think the piece that we always forget in maternal and child health is the father. And he is so crucial and important to supporting that mother. If he has any deficits of his own, and helping to lift him up and strengthen him so that he is able to support her in this pregnancy and beyond. So I think when we look at maternal and child health, we always need to include the father. I would say in the last 10 years, there's been some amazing work done around fathers and supporting them to support moms, but I think we still have a little work to do.
Thank you so much, Wendy, for reminding us that it takes two people to make a baby and to have a healthy baby. So fathers, wonderful. Rashan, a point as far as mental health. So how does mental health impact maternal health?
Sure, so we've got to have a mother who is willing to participate in the care. When you're down and you're depressed, your instinct, pregnant or not, is to get under the covers, pull the covers over your head, and not deal with day-to-day things that you need to do to even take care of yourself, right? You don't want to take a shower, you don't want to eat. So certainly a pregnant mom isn't going to want to invest in getting prenatal care, to take the time out to make appointments, to even follow the regimens that the physicians have prescribed for her to ensure a healthy pregnancy and to continue with those appointments. So when we talk about support, we need that for the mom. We need to take off the stigma that still exists around mental health in general, but particularly for pregnant women and much more postpartum mental health, right? There's still a stigma that we're to do it all and to be able to, you know, have a job, be a good mom, and do all these things. So, you know, mental health has a big impact on the care.
Absolutely, taking off coats, or capes, I should say. Jemea, would you like to add anything?
Yeah, I was just thinking, I realized I didn't really say much about myself and the organization and what we do in this space. And so the Center for Black Women's Wellness, we are a community-based nonprofit organization a couple of miles away from here. And we're really focused on improving the health and well-being of underserved Black women and their families. And I cannot really talk about our story without acknowledging the investments that have been made. Federal investments, we are a Healthy Start grantee, and there are 6 across the state. And that is a program for communities that have infant mortality rates 1.5 times the national average. So we shouldn't feel good about that, but we do think it's important that our tax dollars, you know, and these federal investments are supporting the work around mamas and babies. Kaiser Permanente has been a staunch supporter as well with some work that we're doing around doulas, as well as, of course, United Way, who's always been committed to maternal and child health. And so really, when you asked about mental health, there are a few things that we do. One is that we are a direct service provider. We provide well woman care to those who need it most, those who have no insurance or who are medically underserved and underinsured. They have no insurance, they're in that coverage gap, or they actually have insurance, but those, you know, deductibles are so high that they really surely are underinsured because they're not appropriately accessing their insurance to get health care. They're coming to us, and it's easier for them to pay a small fee than to deal with high deductibles. But we're doing the well woman care, the primary care, and mental health supports in a culturally competent way, but also in a way not everyone wants therapy or needs therapy, but we want to destigmatize therapy. We also offer psychiatric services, so there's medication management, but then other things that have been really birthed from the community, like, you know, yoga and all other kinds of things that are therapeutic in nature, because so much of it is about reducing stressors. And I think we kind of leaned into that a little bit, talking about in a city like Atlanta, this region that has so much access, so much wealth, but this whole wealth gap. And we have to really talk about how there are stressors that are killing us. And so mental health really should be very broad. And so we do that work. And then also in terms of our care management team, we have those perinatal case managers, and many of them are women with lived experience. They have been through a lot of what these moms have been through that they're serving. We have a nurse case manager who is doing things around blood pressure monitoring to deal with some of those issues that really address poor maternal health outcomes. But then also a mental health therapist that was designed specifically around maternal mental health, and that was actually chosen by the moms, which we think is such a wonderful, empowering experience that our moms got to choose which therapist they wanted to bring onto the program. And that experience alone helped to destigmatize mental health. It helped to build rapport, and we have a 100% completion rate, referral completion rate now in that project, because moms can identify with that therapist. So the mental health is critical, but a full, ecosystem of support and providers, and that includes all of us. Let me just say, we may not be providers per se, but we are in community with mamas, and we have an opportunity, and I know that this is what this InForum is about, like thinking about what can we do, how can we be advocates, how can we support families, and really make sure that our communities thrive.
Thank you very much. Jemea, you just brought up the concept of being underinsured. Wendy, can you help us understand what's available, what resources are available for women in Atlanta who may be uninsured or underinsured?
Sure. The most important thing I guess I could lift up is the fact that if you are primarily poor or and you're pregnant, you will be eligible for presumptive Medicaid. You can go to any health department.
And can you explain what Medicaid is?
Sure. Medicaid is a federal and state program that support the medical needs for women, well, families that are below the federal poverty level. What a lot of people don't know is that pregnancy Medicaid is available to even some women that are not natural born to the U.S., but they fall into whatever criteria that is required by Medicaid. You go into a health department, you apply for it, and then it is submitted to what they call a right from the start Medicaid worker. When I worked in Clayton County, we called them an RSM worker. We actually had an RSM worker that worked within our health department that assisted us in ensuring that women that walked in that were pregnant, usually they're coming in for WIC, and one of the things we always ask, do you have medical coverage? Because we do know that prenatal care is extremely important. So we would connect them to the RSM. We would complete the application with them. The RSM worker would then make sure the application was correct, and if there were any challenges in getting it approved, they would assist us, and that woman would walk out with Medicaid that day and then have the ability to go to a doctor to begin her prenatal care. That we called it pregnancy Medicaid. That would stay with her up until 6 months after she delivered. The other nice thing or amazing thing that happened in Georgia quite a few years ago now, the legislators made it possible for a woman to access, if she wanted to, an IUD before she left the hospital after she delivered. Because we've all heard the stories, women would go for their 6-month checkup and they would be pregnant again. And we all know the importance of spacing pregnancies and so forth. So when the legislators passed that, in public health, we were pretty excited because we knew that would improve the maternal mortality rates here in Georgia.
Thank you. Last month, Serena Williams wrote an op-ed in Time magazine talking about the maternal health crisis in America. Maternal mortality, a few more definitions, is death during pregnancy and up to 42 days after delivery. A pregnancy-related death is death during pregnancy and up to 1 year after delivery due to a pregnancy-related complication. As in our setup piece, we learned that the United States has the highest maternal mortality rate in comparison to other wealthy countries, and that Black women die at a rate of 3 times as our white counterparts. Georgia has the 3rd highest maternal mortality rate behind Louisiana and Mississippi. Usually not good to be behind Louisiana and Mississippi unless we're talking about gumbo. And I think the thing that frightens me the most, is most concerning for me, is that 84% of these deaths are preventable. So when we talk about maternal mortality, we're talking about children who do not grow up with their mothers. You know, it's not just the statistics, it's someone who doesn't have their and we have so much work to do here in the United States. But what I'd like to pose is we had some easier questions to ease you into it. Now you're warmed up. I just want to know why so many mothers dying in the United States, specifically in Georgia, and we're all Black women. I want to know why are Black women dying?
Well, I think that question is still a mystery to a lot of us. Years ago, I had again in Clayton County, had the opportunity to look at some data. And in Clayton County, the data showed that an educated Black woman was far likely to have an unhealthy pregnancy than a white woman. Said to us that there are some issues going on with Black women that we don't necessarily have been able to put out.
Serena Williams, the greatest tennis player, can almost die.
And in Serena's story, the one thing that she has always said that she was adamant that something is not right.
Wrong.
She did not feel right, and she and her husband had to get them to understand that there is something wrong. She knew that there was just something that was not right. And in another story, I think we've probably all heard of Judge Hatchett's son and his wife who delivered, and you know, this woman had the best prenatal care in the world, and when she delivered, she very unexpectedly passed away. So, but again, she wasn't feeling right, but no one heard her in that case, and she passed away. So I think we still have work to do to understand what is going on with Black women, that they're just sometimes not able to pass that postpartum period.
Tamara.
I'm smiling not for a good reason. So I agree with everything that you said, Wendy. I think that's a multi-layered question, but something that I'm proud of that March of Dimes has done since the time that I've been there in the 3.5 years is we have to call out the elephant in the room, systemic racism, right? Period, point blank. And again, as a Black woman, what you mentioned in terms of, and it's disheartening as a Black woman, right? So a lot of the things that are supposed to protect us as Black women, right? They tell us to go get an education. So having a higher level of education, being, you know, in a certain socioeconomic status, having a higher level of income, being married, having a partner, is Serena a millionaire or a billionaire? Either one, right? Those things don't protect us. So just to the point of what Wendy said, we can go do all those things, do the right things, and because of our systems, we're receiving medical care in a racist system, right? We're not protected. Now that's disheartening, even though I would love to dismantle racism, and it's part of my personal mantras. That takes a long time. That's systems change work, right? Which we can all start to be talking about systems change work and what that means in terms of maternal health. But also the other things, what Wendy mentioned as well, when we talk about, and many of us have heard this story in the maternal and child health field, Judge Hatchett's son, Charles Johnson, his wife, Kara Johnson, again, all those things that didn't protect her. She spoke like 5 languages, traveled around the world, died in 2016 in California, giving birth to her second son, is hemorrhaging. And she and her husband are saying something is wrong, and nobody listened to her. There are unfortunately countless stories of Black women saying something is wrong, and we are not listened to. Now that's something we can work on in the healthcare system, right? Like our healthcare providers should be listening to all women, should be providing culturally competent care to all women. So no woman should be saying something is wrong and she's not listened to and paid attention to. But that's definitely an issue for Black women for sure. One of our great partners, she's not up here today, with Black Mamas Matter Alliance, they have like prolific research on just that alone, okay? And then something else that I wanna mention that Rashan mentioned, preconception health, right? So as Black folks, as people of color, because we are in a racist system, we show up and our bodies are weathered. So yes, all the things, right? We're more likely to have high blood pressure. We're more likely to be diabetic. We're more likely to be obese. But let's start talking about that in our community. So even though we're in this system and our bodies are weathered, we can talk about how, as a community, how can we, have better meals, cook better, whatever the community conversation is, right? So that we're less likely to be obese. We can manage our blood pressure. So those things are important as well. And again, it's something that we can do about it. So I'll stop there. I could go on forever, but I'm gonna stop right there.
We want to save a little something as we continue. Rashan, first of all, what's a doula? And then how can doulas improve maternal mortality?
A doula is a trained professional to support the woman through the prenatal, the pregnancy course, and the postpartum phase. They provide education, resources, and advocacy. As Tamara talked about not having a voice or feeling like you don't have a voice. They are trained to be that voice for the mother, to speak up at the doctor's visits, to speak up at the hospital, and be that advocate to say something is wrong. And then as they do this across several pregnancies, working and engaging with several moms, they become, experts in the way to navigate and help the patient navigate through the system. What I do want to point out, though, is that oftentimes, doulas are confused or interchanged with midwives. A doula is not medically trained. A midwife is. They are certified by the board. They can deliver babies and provide medical care just as competently, in many cases, as a physician, right? So a doula can be anyone, any of you in this room, as we talk about charging, what's your charge to action, who has a passion for this work, a passion for mom and advocacy, can go and get trained to become a doula and provide this support, educational resources, and advocacy for our moms. And I want to turn this mic over to Tamara, because I learned today that she is actually a doula. I want to see what she has to add.
Thank you. We do all the things, right? We have the full-time job, a doula, husband, 2 kids, all the things.
Retire your kids.
Thank you, Rashan. I love being a doula. One thing I want to say about doulas, I'm so excited that we, in the community in general, are really starting to talk about doulas and how they can be, and this is key, you all, a piece of the solution. Doulas are not the be-all to the end-all. And I feel like sometimes the conversation is starting to turn that way. Doulas cannot do it all. They have to be a piece of this solution. But all the wonderful things that Rashan said, so the way that I talk about being a doula is I'm basically your birthing BFF, right? BFF, best friend forever, for the folks who have young kids and they use that language. And so as your birthing BFF, my goal is to provide you with compassionate, culturally relevant support for you to have the birthing journey that you want to have and that you deserve to have. We are also, again, as a Black woman, we're going to talk about safety. So we can have a birth plan and what we would like to happen and what should happen, and also including that you get respectful care. But if we need to make a pivot to ensure, which this is a very low bar, right? To ensure that you and baby are alive, we are gonna make that pivot. So those are the kinds of conversations I have with my clients. But I love the advocacy piece. And what I tell my clients at the end of the day is I'm a partner with you for you to advocate for yourself, because it is your body and it is your birthing experience. So even there, I'm there to support you. You have to advocate for yourself. And of course, we talk about what that means. And to Wendy's point, including the partners, which most of the partners are males, but sometimes you can have a partner who's not. But including the partner who is a part of this experience as well, right? It's not just about supporting the person who's given birth. The last three things I'm gonna say about doulas, why they are a part of the solution, and of course I'm biased, I think everyone should have a doula, but particularly Black women. So doulas have been shown to shorten your labor. Doulas have been shown to, in general, a person who has a doula, they're more satisfied with their birthing experience. Doulas have been shown to increase breastfeeding and initiation of breastfeeding. And doulas have been shown also to reduce the strength, essentially, of contractions. So there are many, many benefits of a doula. Again, I think they're one piece of the solution, and we had to be mindful of not thinking that they are a Band-Aid and can solve everything, but they are an important piece of the solution.
Definitely no magic wands.
No magic wand. I just really want to thank you for lifting that up because we love doulas, of course, and everything that you said bears true with just our moms and what we're experiencing in the short time that we've piloted a doula project through funding from Kaiser. We've been able to connect around over 60 of our moms to doulas, and what you're saying is true, that enhanced childbirth experience. It has been amazing. Also, their ability to, they're better advocates for themselves, and they feel more empowered and supported. And I think support goes such a long way. It's a big piece. But I'm so glad that you said it, because I think all of us intuitively, we want answers, we want solutions. We're solution-oriented. And what we're understanding and hearing is that this is a complex system that was designed to create these inequities. And so we can continue to chip away, chip away, chip away. We need to all have this will to do something, and there are very specific actions that we can take around addressing systems change. But again, this has been designed to create these inequities, and we just have to address it. We have to just call it what it is.
Absolutely. We didn't get here overnight, so it's going to take some time, energy, and effort, and that's working collectively. I'm hearing community is really very important, that a doula is an advocate. It doesn't take the place of your partner or your mom or whoever is going to be at the bedside with you, and that also I just want to make certain that we understand that a midwife as an actual nurse who's gone on to do extensive training and is able to deliver babies. I think what's really exciting is that the federal government, and please correct me if I'm wrong, is now having some reimbursement for doula services. So it is a piece of the puzzle. Now let's talk about low birth weight babies. Low birth weight baby is a baby that weighs less than 2,500 grams. For those of you who grew up with the English system, as opposed to the metric system, that's about 5.5 pounds. So that's a little baby. In metro Atlanta neighborhoods where the child well-being index is low, 15% of babies are born at low birth weight. So how can we reduce the number of low birth weight babies, and how can we address those factors? Rashan, do you want to start us off?
Sure. You know, I love to talk about health. So, I mean, for me and the perspective at Kaiser Permanente and how we care for our moms, again, it's back to controlling that blood pressure, making sure that our moms are not having high blood pressure, what we like to call preeclampsia, and that, you know, we're keeping an eye on their weight and so forth. But that's really the main thing for us in prenatal care. We can't talk about it enough. The doulas really can help in that aspect, in that sometimes pregnant women may not trust their provider. This provider may not be the provider of choice, but it's nice to have the doula or even another care support person who can be that neutral party that they trust and encourage them to follow up and follow through with their prenatal care. So we really can't stress that enough.
Wendy, would you like to add something?
Sure. I think a big part of reducing some of the infant mortality that we see is a lot of what Rashan said. When we encounter women at the health department, again, it is crucial to ensure that she's connected to prenatal care. Also connected to things like WIC, and if she's eligible, food stamps, and then also connecting her to any and all services that we think she would be eligible for. And sometimes, you know, she's presenting that she's homeless or about to be homeless, or she may not have adequate transportation to move her around to and from doctor's appointments. We've also found at the health department that doing a perinatal case management assessment is crucial. We've had an opportunity to have a home visiting program. We use parents as teachers, which is an evidence-based home visiting program, and that provider is walking hand in hand with that woman throughout her pregnancy, also connecting dad again to some sort of fatherhood support initiatives, and then our hope at the end of the day is that that baby is born beyond that 5.5 pounds, and that baby does at least get to 37 weeks of gestation, and
because that's a preterm birth.
Correct. So I think, though, from the health department perspective, because I think most people look at the health department, they think of STDs and WIC. But, you know, we do so much more at the
Clean water, clean air.
Yes. It's just a wide variety. In maternal and child health, we have a long list of programs, which includes early intervention, the current program that I manage, Children Medical Services, just to make sure that if we do encounter a baby, that they are connected and case managed and have the best outcomes possible.
Absolutely. And Jemea, how does your organization help to reduce the number of low birth weight babies?
Right. With our federally funded Healthy Start program, we do have perinatal case managers, right? And so we have 6, as I mentioned before, many with a shared lived experience. They are doing home visits. We use a curriculum out of Florida State University called Planning for a Healthy Baby. So they are doing education. They are linking to prenatal care, linking to all other sorts of health and social services as needed, providing that support, education, removing barriers for transportation. And I appreciate that we've talked about social determinants of health, but we've also addressed the fact that that in and of itself does not determine, you know, it does not address Black maternal mortality or morbidity. But it certainly is a framework, right? We do a lot of work around social determinants of health and housing, food insecurity. Around 75% of our moms have some form of food insecurity. That is important, so we rely on partnerships like March of Dimes, where we have done Gooder pop-up, you know, grocery stores. We work with Open Hand, who does Cooking Matters, which is all around food prep designed for, you know, low and moderate income families. So we really work to try to address those factors, knowing that, again, it's a framework, but not the only framework and not the only dictator of what results in these inequities. But certainly, the last thing I will say, and it was already lifted up with mental health, is reducing stressors, because stress is such a big indicator in terms of, you know, low birth weight and premature births.
Absolutely. Thank you. Rashan, would you like to?
Yeah, I just wanted to share one thing. Really, the theme here, you know, from what Wendy has shared and Tamara has shared, is that we have to wrap around the mom, right? There's these wraparound services that we offer. There's no one doula, no one physician or anybody that's going to be able to support mom through an optimal pregnancy. And at Kaiser Permanente, our team under the Perinatal Patient Safety Department is published for our cocoon model, which is that wraparound service.
New England Journal
in
of
the
Medicine,
New
if I may
England
say
Journal
so.
of Medicine. So
Big deal.
look up that model. We're doing our part, advocating, sharing the cocoon model, which is just, a formal way of putting all of these wraparound services. And any of us can do it, whether you're a healthcare organization, a nonprofit, but you too can create your own cocoon model that includes the physician, the maternal child health nurse, the licensed clinical social worker who's providing behavioral psychosocial counseling, the community case manager, the dietitian, the midwife, all of those people wrapping this mom like they're hugging them like a cocoon to kind of support them throughout their pregnancy journey.
Absolutely, thank you. Let's shift a little bit to education. In one neighborhood, 90% of mothers without a high school diploma. How can the lack of education impact a mother on her pregnancy journal, and how can we provide them supplemental resources? Tamara, would you like to start with that?
Sure. So first, I want to uplift again that we've already talked about that, unfortunately, for Black women, right? A lot of things that are protective should not be, including having high levels of education. But as we look at the Child Wellbeing Index, seeing those indicators as related to education. So for me, in general, right, we've talked about the importance of prenatal care, and I know Wendy and Rashan will chime in more. And we have to get to the prenatal care appointments, right? So if I don't have a high school education, or I just don't understand perhaps the importance of that, I'm probably going to be less likely to make it to those appointments, right? So I think that that's really an important but simple piece that we can, wrap around that. And I'll let these two ladies chime in.
Yeah, I think, for women who don't have education or a high level of education, we have to think about what are they doing with their time. We know they're likely on social media, and how can we use social media to support and showcase a lot of the organizations and services that we offer in the community so that they can tap into those resources.
So there's a TikTok.
Can do.
Okay.
There's Instagram and there's Facebook,
Okay.
and many of our organizations have platforms here. And so I just think that that's one opportunity to figure out how do we push it to the audience who needs to see it. I mean, outside of the other things that we've already talked about, but just adding a new niche here to the conversation.
Absolutely, thank you.
I think one of the things that Georgia has been successful in is reducing their teen pregnancy rate. We've made tremendous strides in that over the years, and as you alluded to, Rashan, if that mother is completing high school and going on to college, her focus is different. She's making different decisions, so therefore, having a baby when you're not quote unquote ready would not necessarily be something at the forefront of her mind. So I think just continuing and using social media, as mentioned, that's a great platform. And then I think also at the high school level, just having those real conversations. I know there's curriculums out there that help to discourage, young men and women from becoming parents at an early age. And then I think also, again, as a community, rallying behind our young adults. I have a granddaughter that's about to graduate from high school, and one of the things that I've said to her is that, having babies is not an option for you until you are ready. And, just having those real conversations with her about this is what could happen, or this is how your life will be impacted. You've talked about the life that you see for yourself. Right. So just talking to teens as a whole about what do you see for yourself. And unfortunately, some teens don't see beyond what they see, because there are, unfortunately, generations of a lot of these social determinants that we see, but trying to put people in young people in a position where they see different, so hopefully they do different.
Definitely, and certainly we know that the HIV rates, the increasing rates of syphilis for Atlanta, there are other opportunities to talk about, not just pregnancy, but also prevention. Okay. And as we move to our roundtable conversations, what I'd like to do from each of you is to give us one thing that we should be thinking about as we move forward in trying to reduce the maternal mortality rate and really just have healthy mothers and healthy communities here in Atlanta. So I will start with you, Jemea.
Sure. One thing I've been thinking about, because I've talked a lot about what we do kind of on the ground, but the systems change work that's so important. We did some work a couple of years ago working with the multi-sector partners, and we still do this work. But there were a few things that really hold to be true, and we're still doing it, and I invite people to be a part of it. One is removing the silos, right? Because you pointed to, no one lives in silos. We don't show up into a healthcare system just for one issue. There are a lot of different needs and opportunities that can be addressed, right? So removing the silos. The other thing is really, how do we have these nice warm handoffs between the system and the community? And so one of the things that we've been working on is, okay, yes, you're in the hospital for a specific period of time, you're in the system. We want to make sure that that system that is safer and more respectful, right? You have a safer and more respectful childbirth experience, but that the system understands and knows about what the available community resources are, because most of the mortality happens outside of the hospital, it happens in community. So I think that there's some things that we can work on and that I would love to talk more about. The other thing is we are working on a project called AIM-CCI, and it's simply community-based, almost like a checklist of, if we standardize this approach, here are the things that we can do, right? Just like hospital systems have safety bundles, we can do this in the community. So for example, what does it look like if all community agencies did intimate partner violence screening? What does it look like if all agencies really educated people on early postpartum warning signs? And there are resources out there. And what would it look like and so the list goes to encourage all moms to go to that postpartum visit within 12 weeks, but also to identify and address the barriers that prevent her from getting there. So those are examples of how, if we all knew this, right, that we could all work collectively to chip away. The system, we know the system has been designed to do this, but we collectively can chip away. And that's, I think, what I would love for us as we think doing these roundtables, to think about our role and our part in doing that.
Okay. Brief?
I know, right?
2 things. Rapid fire.
Okay. I want to say ditto to everything that Jemea said. I didn't even get to plug all the things that Jemea and Center for Black Women's Wellness and March of Dimes does, but she definitely mentioned one of them, so we'll leave that for another time. The 2 things I will say, these conversations are important, but they can be overwhelming, right? So it's like, what can I as an individual do? I think it's 2-part. What can I as an individual do, and then what can
I'm going to add right
this
now,
organization
today.
Right now. So the first thing is, you're doing it. You're here having this conversation. Continue to have these conversations. No, it's not comfortable to talk about Black maternal mortality at the dinner table, but we have to, right? I think a lot of times people in maternal and child health, because we're talking about it all the time, we think everybody is talking about it. This conversation is not happening as much as it should, right? So that's a simple thing that you can do. Continue to have this conversation. Another sort of simple thing, which goes to the advocacy and the systems change, we have to, you all here in Georgia, even though I've been here for 20 plus years now, so that means I came when I was 5, right?
You're a peach.
There are some things that should be happening in Georgia that are not, that are happening in other states, right? So we've been talking about doulas. How can we get doulas medically reimbursed not just by Medicaid, but eventually health insurance systems? That's gonna be a policy change. Right? And so policy change, we had to pull that lever too, but we have to start on the ground advocating. Call up your representative, and whether it's doula or whatever, start advocating so that we can get to the point of having many of these policy changes that we need. Those are my 2.
She's gonna make me take this mic, so I've got.
I don't know why I keep doing that. It's the New Yorker in me. Pass the mic.
Yeah.
Pass the mic.
I want to keep it simple. I know we're charged for time. Really is to donate, donate, donate. And by donating, you donate your time. Tamara can't run her organization, her nonprofit. A lot of these nonprofits need people to donate their time, put together perinatal kits, donate diapers, different things the resources that are provided for the women. So you donate your time. If you have a small amount of funding, donate. United Way, everyone can use funding to leverage the nonprofit. So donate, set a goal for yourself today. How much of your time can you donate to one of these nonprofits? Maybe once this year, twice this year, you're gonna do it. For us and my team, we aim for 4 every year that we're doing some sort of nonprofit community engagement and volunteerism.
Time, talent, treasures. Pick one. And Wendy, bring us home.
Okay, finally, I agree with everything the panel has said, but I think the one thing that can be crucial is at the great grassroots level, understanding the data and what it means, because a lot of times you hear maternal mortality and most people don't know what that means. Exactly. And just to give them a basic framework, I think, that will tug at the heart, that will tug at the purse strings, and then also hopefully cause people to move to action.
Absolutely. Thank you very much for bringing it back to, it's about mothers and mothers in our community who may not be here. And we want to make certain that we have healthy moms and healthy babies. Thank you very much to our panelists, Jemea Dorsey, Rashan Knight, Tamara Mason, and Wendy Miller. Thank you.